Okay, that's good. So hello everyone, welcome to this panel. And because the Professor Xiaofeng Luo has some other issues, so I will be this chair. And I hope to quickly to introduce our chair, the Professor Xiaofeng Luo, who is an associate professor in the Institute of Social Medicine and Health Service Management. So he is mainly engaged in the epidemiology and health statistics research, and the main research directions is AIDS, epidemiology and the social factors and health. So in this case, we hope to really welcome our first speaker, Dr. Qingyong Chen, and who is a Master of Medicine student from the School of Nursing Evidence-Based Medicine Center of Lanzhou University. So his main research direction are methodology of evidence synthesis and evaluation and nursing management. So he has been involved in the writing of several books on evidence-based methodology, as well as the development of Chinese standards and evidence-based clinical practice guidelines for lung, breast, and prostate cancer screening. So he was mainly involved in the network meta-analysis of drug for patients with traumatic brain injury and the development of guidelines for postpartum and care for pregnant women and the methodological study of living systematic reviews. So Qingyong, could you start your presentation now? Thank you.
Okay. Could you see my presentation?
Yeah, everything is really good.
Okay, I'm starting. Thanks for your introduction, and I would like to thank experts and scholars from all over the world for your listening. My name is Zheng Qingyong from the Center for Evidence-Based Medicine of Lanzhou University, China. As introduced by the chair, I'm mainly engaged in the methodology of evidence synthesis and evaluation. I have also done some content related to infectious diseases in the past. I'm very glad that WWGS could give me this opportunity to share with you here and want to learn together with you. The first part I share is analysis of the hotspots and cutting-edge trends of AIDS research among college students at home and abroad. Let's get started now. The main content of this part is divided into 4 parts. First of all, we want to introduce a method of visualization. Then we talk about the current situation of AIDS or HIV epidemic, especially for college students, this group. Then we talk about the current related research of the author collaboration network. Finally, we share at present the trends of Chinese and foreign research hotspots in contrast. Okay, let's move on to part 1, a visualization and method, a methodology method. We always present the data in a variety of graphic ways so as to get a more intuitive, eye-catching, and easy to understand feedback. Our commonly used software includes Microsoft Excel, Python, R and RStudio, SciSpace, or VosViver, which we will focus on today. VosViver is a software tool for constructing and visualization bibliometric networks. This network may, for instance, include journals, researchers, or individual publications. And they can be constructed based on citation, bibliographic compiling, co-citation, or co-authorship relations. VosViver also offers text mining functionality that can be used to construct and visualize co-occurrence networks of important terms extracted from a body of scientific literature. This is a form of visualization that we mainly use today, and as among college students is the case study that we use. Let's move on to the current status of the AIDS epidemic. AIDS, acquired AIDS is a infectious disease that pose a serious threat to global health. It's also one of the key infectious diseases in China. And the 2030 Agenda for Sustainable Development was adopted by the United States in 2015, prospered to eliminate the global AIDS epidemic by 2030. But the current global AIDS epidemic situation is still not optimistic, and the proportion of young cases is increasing, which is worthy of our attention. Data show that the average annual growth rate of HIV infection among young students in China is as high as 35%. Foreign surveys also show that nearly half of the 20 million cases of infection each year are concentrated in 15 to 24 years old. We searched the database earlier this year and found that the number of AIDS studies among college students has increased dramatically over the past 2 decades. That is why we select this particular group. And then take a look at study author collaboration network. The table shows the ranking of the number of papers published in English-related studies and their citations. The United States occupies the top position, accounting for more than half of the total number of articles published in English. And it maintains a better citation situation based on high number of articles published. So the United States has a great advantage in this area. Then China, South Africa, Canada, and the UK, and so on. This is the distribution of journals publishing as related research papers of college students. The most published journal in China is Chinese Journal of AIDS and STD, with 257 articles, where the most published journal in foreign countries is Journal of American College Health, with only 46 articles. It can be seen that, in fact, under the condition of the same number of articles published in both Chinese and foreign languages, many domestic journals still maintain a relatively high level of attention to AIDS-related research among college students, which is the embodiment of a point of superiority. This is a cooperative network relationship between authors. Different clusters represent different research cooperative groups. In fact, it can be seen that School of Public Health in various universities and Centers for Disease Control and Prevention in various provinces and cities mainly pay attention to the characteristics of AIDS related to this special group. English publications are mainly the cooperation between Chinese scholars is relatively close, which is also a great advantage. Finally, we will show the current research hotspots and trends. We realize the visualization of hotspots clustering through the software was favored in China. A color represents a research direction and a research hotspot. The first one, epidemiological study on transmission of MSM diseases and related prevention and detection. Effect evaluation of middle school students' behavior intervention. And the last one, the status quo of AIDS, knowledge among college students and the influence of knowledge, belief, and practice education. The left side is the hot keywords ranking, and our research hotspots are also more consistent. Then let's look at relevant studies published in English. The research hotspots also cluster into 3 categories. The first of all is knowledge, practice, and prevention. Then the interaction between risk behaviors such as substance abuse, alcohol use, and sexual transmitted disease among college students. safe sex, and psychological differences between genders. In recent years, the infection rate of AIDS among college students has been high. The proportion of money, or in other words, goods, transaction in the possession of sexual behavior has increased, and the rapid development of the internet has increased the channels for men who have sex with men. That's what we call MSN. Is mainly spread among college students. This may also be why we are all committed to focusing topics related to knowledge, practice, health, education, and sexual behavior prevention. HIV voluntary consulting testing, an important public health strategies, which can be found that HIV patients as early as possible and provide corresponding treatment and care services. HIV censure surveillance to provide you with the development of transmission and distribution of long-term continuous system of observation. The understanding of HIV or AIDS population trends and policy and intervention evaluation plays an important role in the prevention and control. And studies about alcohol use, substance abuse, and other topics. In China, at least for the college students, this special group no or less mentioned. Risk behavior in college students has been very common in our country, which should cause our enough attention. Overseas studies have pointed out that college students of all kinds of risk behaviors, such as alcoholism, drug abuse, often associated with sex tendency. As a result, the infection rate of AIDS increases, suggesting that domestic research in this field needs to be further carried out. That's all I shared in part one. Thank you for your attention. Next, let's enter the sharing of today's theme content. The first part is a case study of the application of our methodology. The main content we share today is the past and present of living systematic review, and we also study status and progress by means of bibliometric ways. Due to the limited time, we only analysis the main content of the study. We hope that what we're sharing will be helpful to all of you. So let's get started. We're showing the same four parts. In the first part, we will introduce what is living systematic review, and then we will introduce the brief history of LSR, the current research progress and hotspots of LSR, and our prospect of the future. Let's first understand what living systematic review is. In the world of evidence evaluation, this is a familiar picture. The shape and the grade distribution of the pyramid indicate the grade of evidence quality. Basic studies such as cell animals are considered low grade of evidence quality. Case control studies and randomized controlled trials with the highest quality of evidence in the original studies, all of which are all considered higher grade of evidence quality. In addition, systematic review and meta-analysis have been occupying the top of the pyramid. But could we ask, are they really perfect? That's the question. Professor Elliott first proposed the concept of living systematic review in 2014. And what he described is a very important opportunity to bridge the gap between evidence and practice. So what's the gap? It's time, the amount of the time it takes to produce evidence until it is applied. The method of SR and meta-analysis have been well developed, but less progress has been achieved with other essential component of accuracy. That is what we call currency. The time from the date of the last search to SR publication is commonly over a year, and it's in an analysis of the time taken for primary study result to be incorporated into an SR. The median time from primary study publication to SR publication ranged from 2.5 to 6.5 years. So the concept of live systematic review come into being. Live systematic review are high quality, up-to-date online summaries of health researches that we updated as new researches become available, consistent with the vision of the pioneering Oxford database of perinatal trials to include a library of trials overviews, which will be updated when new data become available. So let's talk about how AirSR has evolved. A brief history of AirSR. We come through the timeline of the occurrence and development of AirSR. In February 2014, the concept of AirSR was first created in plant medicine by Professor Ellen Zheng, with her teams to bridge the gap between evidence and practice. Subsequently, the concept of AirSR was first used in the collaborative European neurotrauma effectiveness research in traumatic brain injury. That is what we call Central TBI project, and it was covered in subsequent updates. The project is dedicated to the integrated treatment and management of patients with TBI, one of whose important tasks is the continuous synthesis of evidence and knowledge transfer. To date, Central TBI program has completed the release of 5 TBI series ARSRS, all of which are distributed in the Journal of Neurotrauma and the Central TBI online website. Following this, the framework of living network meta-analysis, that what we call RNMA, was proposed in 2016, providing complete and up-to-date evidence for the comparison of or intervention for a particular disease. That is what my partner Jianguo will show you later. In February 2016, the Cochrane Living Evidence Network was launched, further promoting the rapid development of AirSR. And an online website was established to introduce AirSR-related concepts, display and estimate the completed research on living data synthesis, and provide learning resources such as AirSR webinar. In the following years, the Cochrane collaboration also published a number of AirSR and RNMA related studies, leading the development of the field. And the Cochrane library is also the platform for retrieving the most AirSR related studies. In 2017, the Cochrane Dynamic Evidence Collaboration published 4 consecutive articles on AirSR methodology in JCE Journal, which systematically discussed AirSR from 4 aspects: introduction, computer-aided automation, statistical method and problems, and living guidelines transformation. This had laid a solid foundation for the rapid development of systematic update of living evidence. In August 2019, the World Health Organization introduced living guidelines for the first time to update recommendations on maternal and perinatal health, ensuring that the guidelines are up to date with the latest evidence, shortening the development cycle and ultimately making them better applied to clinical practice. The first COVID-19 related AirSR study was published in April 2020 by Prof. Vanes, describing the validity of diagnostic and predictive models for COVID-19. In September of the same year, WHO issued the first relevant living guidelines to explore drug treatment and prevention of COVID-19. Over the same period, a number of COVID-19 related studies based on LSR continues to emerge. The above is our brief introduction to the development of living systematic review. So, what are living systematic review studying? We search the PubMed data space for the current systematic review and meta-analysis to compare the published situation of living systematic review and found that traditional SR has a longer development history than AirSR. Up to now, the number of articles is also huge, which has been active in our vision. Living systematic review has been developing since 2014, and it has achieved great development in 2020 and 2021. This is closely linked to the global pandemic of COVID-19. Similarly, we compared the ranking of scholars in research publications, Scales from Germany and Reda from Chile. Domain the papers. Half of the top 10 authors are from Italy, and there are 3 from Germany, 1 is from Chile, and 1 is from Australia. We conducted a cluster analysis of the authors, and it can be seen that there are 10 cooperative groups in total. The internal groups are relatively close, while the connection between cooperative groups are relatively sparse. That's the question, and we want to see the better cooperative in the development of SR. This is the distribution of hot keywords. It can be found that the top keywords are closely related to COVID-19. In addition, it also includes some methodologies and situations of different populations. We will also conduct cluster analysis on keywords distribution. This is a network symbol map of keywords distribution. The darker the color, the higher the rank, which is consistent with our ranking analysis. We divided the overall research hotspots into 5 areas. First, without doubt, the COVID-19 pandemic demands that we get the most accurate and effective evidence as quickly as possible to better advance clinical practice. So, these hotspots focus on the current situation of the COVID-19 pandemic and its controls and treatment. The second cluster focuses on methodological studies related to LSR. The third cluster focuses on neonatal growth and development, dietary structure, and psychological development. The fourth area focuses on the accuracy and offset risk of the disease diagnosis in different age groups. The fifth section focuses on the treatment and diagnosis of chronic disease. Here are the major areas that LSR is focusing on. When we classify the disease currently studied in the LSR based on ICD-11, we find that certain infectious or parasitic disease account for more than half of the studies. There is relatively little research in other areas. In other words, COVID-19 has really boosted ASR research as well. This is the current distribution of journals publishing ASR. We can find that many high-impact journals are willing to publish research on ASR. That's a good phenomenon, and we have seen the development of ASR. There is a survey of the current ASR update earlier this year. About a couple of months ago, and we wanted to update it recently. There are no standard update frequency and requirements, and some studies are not registered. They're not made the specification of ASR study. This is one of the questions we need to discuss at present. There is without doubt that COVID-19 is a hot topic, and many ASR is focusing on that. This is the explosive detection of ASR-related articles in recent years. We can also find that methodological articles have been highly cited since 2014 and up to 2019 to 2020, many COVID-19 related topics have become hot cited. The red color means the cited excellency. Finally, let's talk about the current thinking of the prospects for the future. This is model prediction made by Professor Elliott when he proposed statistical method. The figure shows the result of the four algorithmic mechanisms. In each case, the red dots and lines indicate the progress of updates, and since a random effect meta-analysis of two trails cannot be performed after each trail is added, heterogeneity can be reliable estimate from the third trail. The black line represents a stop boundary for each method. However, the properties of using those models to decide on when and how to update on areas have not been formally investigated. Therefore, we put forward the problems of saturated sample size, which have not been involved in current studies. Also, as we mentioned earlier, update frequency is not accurately regulated. Is there a need for new reporting specification? At present, the research of living guidelines is just starting. Will it encounter more problems? There are all questions worth thinking about. Professor Elliott has a wonderful vision for the development of evidence. Living systematic review also enhance the efficiency and opportunities for knowledge translation. First, living systematic review enable living knowledge translation, including living guidelines, standards, policies, and decision support systems. Second, the value inside the container of an SR can be unlocked when the associated data are made available, particularly as open access to linked data formats. The availability of those data opens up opportunities for integration with guidelines development, platforms, and clinical decision support systems to create a new evidence ecosystem. That's a great idea. Okay, that's all I have to share Thank you again for your careful listening. Let's back to chair Dr. Yu.
Okay, thank you so much. So actually there are so many questions they have, and if the attendees have different questions, please ask at the Q&A box, and when two speakers finish the speaking, and they will answer all the questions together. So I do believe like Dr. Qingyong already shared like two main parts. The first part is about the AIDS-related research in China and abroad for college students. So he shared in detail the research status, the author cooperation groups of the current research, and the comparative analysis of the current research hotspots and trends. As we believe, like due to the differences in the distribution of various cultural backgrounds and geographical trends, so we can see that there are correlations and distinction between the two, and from which we can learn a lot and achieve a lot. So the most important he bring to us is a visual research method, and through different cultural network, the content will be vividly expressed to us. And we also know about like the living systematic review is a relatively new research method in the recent years with a short history of the development. So like Mr. Qingyong described in detail, the conceptual significance and development process of living systematic review, and also showed the development, how to research trends and the future directions of living systematic review, like by using the way of visual culturing. So finally, some existing problems and future prospects are put forward. So if anyone have any questions, please ask at the Q&A box. So now let's welcome another presenter, Mr. Jianguo Xu, to present. And you can share your screen now, and please do the introduction for yourself. Thank you.
Okay. Can you say it?
Yeah, very good.
Yeah, thanks for the introduction of our new chair, Dr. Yu. And also very thankful to my colleague Qingyong for inviting me to give a presentation in the special session of Living Systematic Review. It's my honor to be able to participate in WWGS in the form of an online conference and report to professors, experts, and friends who are concerned about the development of Campbell all over the world. And the topic I will share today is Introduction to Living Network Meta-Analysis. Qingyong has reviewed the Living Systematic Review. Next, I will make a brief introduction to Living Network Meta-Analysis from 6 parts: background, origin and development, production steps, feasibility analysis, statistical methods, and prospects. We know that healthcare professionals and decision-makers responsible for providing safe and high-quality medical service to patients need to obtain the latest research evidence on diagnosis, treatment, and prognosis. Generally, a medical scenario with a specific condition often contains a variety of competing interventions. The traditional pairwise meta-analysis cannot systematically present a complete synthesis of all interventions. The emergence of network meta-analysis provides a feasible solution to this problem. In response to the needs of evidence users, we as evidence procedures should try our best to ensure that relevant medical decisions are based on the latest and best evidence. However, research shows that half of systematicers with published 14 months after the last search, and 7% of systematic reviews are out of date at the time of publication. Incomplete and outdated evidence synthesis will inevitably lead to a waste of resource and have a wide-ranging impact on the users of evidence. Based on this research background, Allet put forward the concept of linear systematic review in 1914 through comprehensive and systematic retrieval of databases. If there is any new research or tool that can be included, the systematic review will be updated immediately. Qingyong has just introduced the linear systematic review in tool. From the concept of linear systematic review proposed by Allet in 2014, and until 2016, Cricket retrospectively analyzed the network meta-analysis for the second-line treatment of advanced non-small cell lung cancer. Then they found that the original published network meta-analysis could not provide a complete and up-to-date set of evidence. Also in this study, Cricket expanded the application scope of linear systematic review and formally proposed the linear network meta-analysis. For the preparation of linear network meta-analysis, we first need to understand that linear network meta-analysis is not a type of network meta-analysis like diagnostic test accuracy network meta-analysis, or the IPDMA, or the prediction model network meta-analysis. It's a new mode for updating network meta-analysis, which is different from the traditional intermittent update. Before deciding to make linear network meta-analysis, we should plan in detail the division of team, the updated plans and steps, the search strategy, the retrieval frequency of each source database, the relevant statistical methods, and the decision-making framework and timing of integrating new research into the network meta-analysis. For example, for the COVID-19 related LNMA participated by our center, if the retrieval frequency is once a month, that is before the next retrieval, the team should complete the screening of relevant literature and data extraction and data analysis at this stage, and jointly decide whether to update the linear network meta-analysis and the corresponding linear guidelines. The release of the initial version of linear network meta-analysis is only the beginning, and the later maintenance is the key point. It has been less than 5 years since the linear network meta-analysis framework was proposed, and it has been constantly developing through exploration, and its formulation steps are constantly improving. Timely inclusion of original research and real-time update of network meta-analysis results are the fundamental manifestation and fundamental requirement of linear network meta-analysis. The update iteration steps in this figure are similar to the traditional meta-analysis process, roughly including the following 6 steps. First, a regular timely retrieval, and selection and inclusion of original research, data extraction, and selection and inclusion of original research, data extraction, and the assessment of risk of bias, and the network meta-analysis results updating, and the last is publishing and dissemination. And in the first step, if no new research that can be included is found after screening, and then we go back to the first step to continue the regular search and record the results of related searches and screening documents. After screening, if there are documents that meet the inclusion criteria, number of documents and the corresponding workload are evaluated, and decide the time to integrate the new documents into the existing evidence synthesis and updated the network meta-analysis. Maybe we feel that undertaking the living network meta-analysis update work requires a huge amount of work, and data analysis is also cumbersome, and it is necessary to ensure that living network meta-analysis update in real time for a period of time in the future. For example, the efficiency of different drugs is compared and a new drug is found in regular searches, and network meta-analysis will get an additional arm, and all the evidence network results need to be recreated. Regarding the feasibility of living network meta-analysis, the key is to determine the frequency and timing of retrieval and update of network meta-analysis results. The same is the Krakow team. We know that Krakow proposed the living network meta-analysis framework in 2016. In 2019, they published an article that systematically analyzed every 4 months, 6 months, and 12 months with different update frequency to evaluate the number of new studies that need to be included in the update, the workload during the update, and the percentage relative to the workload during the initial network meta-analysis. The study evaluated 77 network meta-analyses covering 17 different medical fields. The results showed that an average of 78% of network meta-analysis can be included in no more than 4 new studies per year, and only 7% network meta-analysis can be updated to include more than 7 articles per year. When the update frequency is 4, 6, and 12 months, the average workload for each update is 4%, 5%, and 11% respectively. And regardless of the size of the initial version of network meta-analysis, its subsequent updated workload generally does not exceed 15% of the initial workload, and 15% should be acceptable for a mature, professional, and well-structured author team. In addition, the specific updated time of the living network meta-analysis also needs to be determined according to the needs of evidence users, such as the guideline development team and policy decision makers. How to better promote the transformation of living network meta-analysis into living guidelines is also the current research hospice and the direction. And the emergence of some computer-aided automation methods, strategies, and tools is changing and simplifying the production process of living network meta-analysis. Manpower and computer assistance complement each other, which can improve the feasibility and sustainability of living network meta-analysis, allowing researchers to write, disseminate, and update living network meta-analysis more effectively. The currently approved tools may only be great online evaluation tools and cinema. Other tools based on Java or Python are fine for our tool experience, but if we really used it in the evidence production process, the recognition at this moment may not be very high. But we can foresee is that based on big data and artificial intelligence, as well as the development of living network meta-analysis production, update, and other stages of the workflow, it will definitely enable manpower and automation to be combined in a more effective and efficient way to produce and disseminate living network meta-analysis. The statistical methods of linear network meta-analysis will not be introduced today due to is the same as the traditional network meta-analysis. In terms of statistical methods, linear network meta-analysis also satisfies the three assumptions of heterogeneity, similarity, and consistency. In addition, sequential meta-analysis should be done when doing linear network meta-analysis. We know whenever a new study is included and updated meta-analysis results, the combined effect size and accuracy of the evidence will be recalculated. And more, it is easy to cause type 1 errors, which means the appearance of false positives, and the interpretation of the results needs to be cautious. And nowadays, in the context of the establishment of clinical pathways, artificial intelligence, and the rapid development of big data, the inclusion of evidence source in systematic reviews will not be limited to original research. It is no longer a dream to extract and analyze big data directly through computer systems. And systematic reviews will eventually complete the translation to living systematic reviews, and the timely inclusion of all valuable treatment options into living network meta-analysis will further promote the effectiveness of interventions, predictions, and decision-making. And living network meta-analysis will serve as a bridge between evidence and practice, from evidence to practice, and ultimately achieve the unity to knowledge and practice, bridge the gap between evidence and healthcare practice. And this concludes, this is my speech, and thank you for your listening online. Let's get the chair to our chair, Yu.
Okay, thank you so much for your presentation. So I think there are so many questions at the Q&A box, and I hope like two scholars can answer some of the questions. So for example, like Howard White asked some, like what software are you using for the author and the keyword mapping? So Qingyong, could you answer this question first?
Okay, I have seen the question. Could you hear me? Okay. Thanks for Dr. Howard's question, and I will make some explanation for it.
Sorry for interrupt. I think Jianguo, you could mute your sounds first because there are some echoes.
Okay. So Dr. asked us, could you say more about the method of RSR? What makes RSR living? Is it just frequent updates? If continuous updates, then how are they done? And what's the role of machine learning? Okay. Our study just for RSR explanation and analysis on the current situation of research and introduce the history, living systematic review of evaluation is very complicated to actively cooperate with the cooperation of the team, including team division of label and so on. In the series of Alex introduced many considerations. After we will share the relevant contents to all of you. This is also our RSR differences from traditional meta-analysis and cumulative meta-analysis, but they have some similarities, just as we have just introduced a new big Lagrange work. Machine learning related contents are also mentioned in the share of our partner Jianguo, including automatic data extraction and online website, just like the evidence tools, cinema, quality assessment tools, and so on. What software are you using for the author and keywords mapping? Can you see a bit more about how you do it? is common approach in bibliometric but not evidence synthesis. Okay, it's another excellent question. We use Weaver software to represent author and keywords, hot clusters, and it can help us pass the co-occurrency between different vocabulary of context between different vocabulary to analysis to show the correlating relationship between them. The co-occurrency words will be aligned together closely to render the effect we want, namely linear analysis, just like cluster analysis. Yes, it's not a it's just a bibliometric tool, not a data analysis tool. For data analysis, we need to borrow tools such as R and RStudio, just like data and other tools, and make good use of algorithms and update mechanism to update evidence. Okay, I see some other question. Thanks for Dr. Yu's question. Okay, you mentioned the problem of registration. Okay, we recommend that your SRE need to have a registered scheme. The scheme every time we don't need to register for every time for registration, but we need to register for the first time that we will conduct a living systematic review. We have to standardize each update time limit problems such as what's your update frequency? If there are any issues that need to be updated in time and put forward. If you have nothing between the last couple of months, you have to make a declaration about this problem, and we should keep the current evidence. Okay, the other question I have see what kind of questions are suitable for the study of LSR? Yeah, it's a good question. And what kind of problem is suitable for LSR to study? First of all, we need to understand that LSR is the process of repeating special forms of update on the basis of existing SR. Therefore, if their problems of original research is worth starting, there will be a lot of original researches carried out. And then there will also be traditional SR research carried out, which is the first reason we mentioned. In addition, the update of this issue is of great significance for decision making. If the quality of evidence in the existing tradition SR is relatively low and accurate, reliable conclusion cannot be reached, this is also the reason for us to update. The most important thing is that there needs to be a steady stream of new and original researches. For example, we have conducted a large number of clinical trials during COVID-19, including drug treatment and disease prognosis and rehabilitation when you go back to your home. That's an excellent question. Thanks again for asking, and I hope it helps. Back to chair. Back to you.
Okay, thank you so much for your answering questions. So Jianguo, if you have any, there are some questions for you. So like the Tian Zhao said, like what should be noted about living network meta-analysis compared to living pairwise meta-analysis? And if you have any other answers related to other Q&A questions, maybe you can answer. Thank you.
Yeah, thank you. Thanks for the okay, can you hear me? Yeah.
I can't
find you.
And we know whenever.
Sorry, you need to open your Microsoft.
Yes. And
Okay.
and for this question, what should be noted about living network meta-analysis compared to living pairwise meta-analysis? And it is detected by the network meta-analysis itself. And we know when a new study is valuable for inclusion, it is necessary to conduct an independent bias risk assessment, recalculated the combined effect size of the outcomes, and reuse grid to access the quantity of evidence. And the production of systematic reviews has a strict requirement on human source and time cost input. And we know the living network meta-analysis itself, the complexity will increase the cost input. And with these 2 points, and there is another is living network meta-analysis needs a platform to update the latest results in real time. And the traditional paper method is not suitable for regular reporting of the results of such living synthesis evidence. And we mentioned that there is another question that
Yeah, I think
that's
it's the same question. Yeah.
Yes, by Howard White. To what extent can this process be automated? And in fact, automation is not very mature at present, and we only in the literature retrieval stage, we will use the alert function of the database to put the literatures to our emails automatically. Later, we may use the grid on lectures and cinema to evaluating the evidence grid. And other parts will not use computer-aided temporarily. And we believe in the future that the CAD will be in an important role. And that's all.
Okay, thank you so much for your answering. And yeah, I find maybe there are no more questions. So let me check again first. Yeah, I think there are no additional questions. And thank you so much for your presentation. And I think if someone has any questions, maybe we are really looking forward to hearing from you, or like directly can contact our scholars and to discuss more or interact more. And I think it's time over. Okay. I find another question at here, several to extract effects from the PDFs. So there are another questions from Howard White. And yeah, Mr. Qingyong and Jianguo, could you answer this question, or like, could you see the question at here? Okay, it's a comment, not a question. Thank you so much. We got it. And I do believe like we can have a deeply discussion after the presentation or others. So thank you so much. And because of the time limit, maybe we need to finish this panel. And thank you again, my two scholars. And if you have any questions, please do not hesitate to ask us. Thank you and bye.
Thank you. See you later.
Bye. Bye.
See you later. Bye.